Question 34, which of the following is the most likely diagnosis? Testicular torsion, epididymitis, testicular tumor. All right, so male repro. 16-year-old boy presents to the emergency department with acute onset left scrotal pain. So acute onset. Acuity is always very important. Left scrotal pain, so it's hemiscrotal, so unilateral. Laterality is important. Began while he was sitting in class. The pain was severe from the onset and is associated with nausea. Denies dysuria, urinary frequency, fever, penile discharge, probably not an STI, so that's good. He is sexually active with one partner and uses condoms inconsistently. Again, kind of hinting at the STI thing, but without discharge, yeah. Not saying you can't have an STI without discharge, though. So again, don't rule things out just because it doesn't exactly fit what you know about it. On physical exam, the left hemiscrotum appears swollen, tender, and elevated compared to the right. Gentle elevation of the testicle does not relieve his pain. That's called Pren sign. Cremastric reflex is absent on the left side. This guy is not having a good time. So again, the cremastric reflex is stroking the inner thigh, and you should see the scrotum elevate on that side. But here we don't see that happening. So, okay, here are his vitals. He's afebrile, blood pressure is fine, heart rate's fine, UA is normal. Okay, so pretty benign vitals. All right, so let's go down the list here. Testicular torsion should absolutely be on your menu of differentials when you have really acute onset scrotal pain. Absolutely. So let's not rule that one out. We'll come back to it. Epididymitis also can present with scrotal pain. So we'll come back to that. Testicular tumors don't. Testicular tumors are not painful. Tumors generally are not inherently painful in and of themselves. So I'm going to cross this one off. Could testicular tumor cause a testicular torsion? Sure, right? But ultimately, the cause of the pain would be the testicular torsion here. There was also no mention of masses on palpation, but please, again, don't rule out tumors or cancer just because there's no masses. All tumors and cancers start as a single cell at some point. So they all start very small and then they get bigger. Incarcerated inguinal hernia. So if we had a hernia that traveled down the inguinal canal, it could end up in the scrotum. And if it goes in far enough, you might even hear bowel sounds in the scrotum on auscultation. It'd probably be a pretty big scrotum though. We do have some swelling, right? It is swollen, but usually hernias would present with GI symptoms as well. If it's incarcerated, it could be necrotic. You might expect a fever. It's not giving inguinal hernia. Yeah, I'm trying to convince myself that I see it here, but it just, there's no GI symptoms at all, no risk factors, and it just suddenly happened while he was sitting in class. Seems kind of weird. Usually hernias come from some kind of physical activity. So I'm going to cross that one off, or at least, even if you're not sure, at least put it lower down on your list. Hydrocele could be a large scrotum. It would transilluminate though, but we don't have any, they didn't transilluminate anything, so we don't know. Hydrocele is not painful though. So we're going to cross that one off. So we're down to testicular torsion, epididymitis, Pren sign, and the cremastric reflex are your answers here. So cremastric reflex, again, stroke the inner thigh. If the hemiscrotum rises, that's normal. We have nerves that travel through the spermatic cord that cause that reflex to happen. If there's something wrong with the spermatic cord, then you're not going to get a cremastric reflex. And then Pren sign, painful testicle, you elevate it, so bring it closer to the body and see if that relieves the pain. If it relieves the pain, it's epididymitis. Because the epididymis, right, if this is our testicle here, so the epididymis comes down and then it comes up and around town. Okay, so if that's our epididymis, right, it's kind of just hanging on for dear life. So what you can do is you can just elevate the scrotum, put your hand right here, lift it up. That'll take some tension off the epididymis. And so if the epididymis is inflamed and painful, taking tension off of it will make it less so. So here the Pren sign didn't work, right? We tried it, we elevated the testicle, didn't work. So it's probably not epididymitis. All right, testicular torsion would not get better with elevation of the scrotum because our torsion is just this, this coiling of the spermatic cord, nothing to do with the epididymis, which is next to it. And so again, the spermatic cord here, this little spring, has the nerves that are in control of the cremastric reflex. So you can imagine that this coiling is putting a lot of pressure on the nerves, arteries, and veins running through the spermatic cord, compressing them all. So you're going to get ischemia. That's where the pain comes from. And if you're compressing nerves, they're going to stop working. So your cremastric reflex disappears. So the correct answer here is A, testicular torsion.